Dr. Hema, you being a physician as well as having done clinical genomics from the very prestigious Harvard Medical School, I'm sure you handle so many people with diabetes and pre-diabetes and people who have a family history of diabetes asking you what is their risk of developing diabetes in the future. So I think this genetic test, if a person has a family history of diabetes, both the parents have or somebody else in the family, blood relations have. So this person, while they are in their 20s and 30s itself, can get their diabetes genetic testing done.
Absolutely.
And then to a certain extent, we can tell them about the risk of developing diabetes in the future.
Absolutely. I think the best time to get this done, if you know you have a family history, please get this done. I really advocate for that because you will know where you stand and that's the right time to take the action.
Right.
Of course, once the diabetes is already diagnosed, you will have to take medications and you need to be more careful. Then also genetic tests will be helpful in guiding your medications and knowing how strong you need to be in terms of diet. But the best time is prevention, before you actually hit the disease.
Yes.
Or maybe never hit the disease.
I know,
right?
hopefully.
Yeah, hopefully.
So that's why from the side of our brand, Moderate, we have launched this diabetes genetic risk assessment test. So that people can at least have that knowledge beforehand whether they're at increased risk of developing diabetes and pre-diabetes, so they can be much more careful.
Absolutely.
Or if the risk is not high, then they need not torture themselves and every day have that fight, should I eat rice, should I eat sweet, should I not?
Right.
So in order to help them with this kind of an understanding, we have started doing this test, and then we have made the test extremely affordable. And it's also very, very simple to use. It's just a swab that people rub it on the inside of the cheek to collect the cells. Just put it back and call us. We pick up the kit and then we send it over to your lab for analysis from your side.
And it takes about 3 to 4 weeks. I would say give it 4 weeks for the entire analysis. And after that, the genetic counselor will sit down with you and go over the entire report step by step in very simple language. So you know what's supposed to be done in terms of your diet, in terms of your lifestyle, and whether you need further follow-up with your physician.
So not only from the preventive aspect and to know our risk of developing diabetes, but if a person is already a diabetic and they get this genetic testing done, I think it will also help them in letting them know their propensity to develop the complications.
Yes, absolutely. So that's a very important thing because you need to know there are different screening tests. Like yearly we do eye exam screening or the kidney screening. If the endocrinologist knows ahead of time how strongly to screen you, then that will really add value in preventing that particular disease. If there are no risks of complications, then you don't have to try so hard in terms of diet. Maybe you can slow down a little bit. So it will all depend on your genetics, what you are prone to. So it's very important even for diabetics. And maybe at some point they can get the pharmacogenomics done as well to know the right medication for diabetes, which they should be using. And that will prevent a lot of side effects as well. Right.
So even if a diabetic can get this test, we will know how much at risk they are for developing these retinopathy, neuropathy and kidney diseases. And that way, if the risk is very less, then like we said, they need not really worry too much or maintain their blood sugar levels in that absolutely strict levels, right? The borderlines are also accepted.
Absolutely.
I think this will help a lot in enabling us to lead a much more happier life, a much more satisfied life.
Stress-free. You don't have to constantly worry about your blood sugars all the time.
Right. And the best part is this extensive dietary sheet that we can get also based on our DNA analysis as to what should we eat or what kind of diet if we have, will our blood sugar not spike much and which is much more safer for us. I think having an extensive sheet like this with a variety of dishes will help us in planning our meals and like I said, not going overboard and restricting ourselves from eating what we like.
Yes, absolutely. So the individual will be able to know their risk of diabetes, the chances of the different complications, and apart from that, their nutrition metabolism as well, like carbohydrate metabolism, protein, their lipids, and also the amount of workout that they need to do. Along with that, we are also going to curate a few diet plans based off of their metabolism results that we get. So that will help them give an idea as to what kind of diet they should tentatively follow. Then of course after that over to the nutritionist as well as to what she or he tells them, right?
So to summarize, the people who can get this diabetic genetic risk assessment test would be people with a family history of diabetes, who would want to know their risk, as well as diabetics who would want to know their propensity to develop complications and how
Yes.
responsive they are to
Yes.
medicines and what kind of a diet they should take.
Mhm.
And people who are also slightly overweight or obese,
Yes.
for them to know their insulin resistance, insulin sensitivity,
Yes.
and how much at risk they are to go on to developing diabetes and other
Yes.
complications in the future.
Honestly, the kind of environment that we are in terms of the foods and everything that we are
Yeah.
exposed to, I feel like every individual, once they are an adult, should get this test to know where they stand, how much effort they should put in, because the reason being diabetes is a major risk factor for heart disease. And these days we see a lot of young people, unfortunately, getting heart attacks, which is not good at all. So I think it's always good to know ahead of time. I think every individual, anyone who's above 20 should ideally get this, and I strongly believe in it. You know your genes, this is your personalized genetic makeup. At least have a look at it, and you can act accordingly and make informed decisions.